Thank you very much for having me here, especially Pro Patria and Charles Sturt University. I think talking about these things is something very much needed. It's about getting the word out to people, giving them options. Not every veteran's going to be treated the same, and we need to make sure that they have access to different things. And I believe this is one of the a great option as we'll go through. Again, I know we're short on time. Obviously, they're the different things I've done involved with some University of Wollongong research and things like that, which I'll talk about coming through. I'll go through the first part of this presentation quite quickly. It's really the why did I do it? Why am I doing the medicinal cannabis and sort of treating veterans and things like that? As we all know, veterans are everywhere. They're spread out throughout Australia. They can't access treatment in every location. We've got to be able to make sure that we can actually try and provide options to each and every one of them, and obviously everyone can't do everything. So they're all throughout Australia, throughout New South Wales. There's about 600,000 of them, and lots of them need a lot of different support. When we look at the different things, compared to normal civilian injuries, there's a lot of different ones that veterans have. So remember that they've been through service, they've got physical injuries, they've got complex mental health as well. Whereas when you look at the general population, yes, they've got mental health issues, they've got those sorts of things, but comparatively, we've got a lot of young veterans with a lot of physical and mental health injuries, as opposed to the sort of arthritis, diabetes and things like that of the general population. Again, looking at New South Wales, again, they're spread out, and that's what I wanted to point out with this, that a lot of them are spread out around military bases, and so there's sort of these groups, but a general practitioner, if you're not focusing on veterans, will probably have about 2% a veteran cohort. So they're everywhere, and we need to be able to identify them and provide support for those veterans. So again, we're in Wagga. Grew up in Wagga, it's a lovely place. We got the RAF base and the Kapuka, and amazingly I joined the Navy before joining the Army, so there you go. Anyway, looking at as I said, with the general population in Australia on the left-hand side there, the different medical conditions, the top 15 medical conditions that the general population have, as opposed to this is one of the Merck, the Durka and the VA, etc. for DVA, the listed top 15 conditions. So you can sort of see there's a lot more physical and mental health conditions, and obviously the veterans are usually a lot younger as opposed to the general population. One of the things we talk about is the invisible injuries. So these are the ones that you can't physically see. A lot of veterans will not talk about some things. They'll come in and they'll have these different conditions. So I talk about the long tail of the disease. So PTSD, mental health is not something that you come in, you see it once, you treat it, you give them a tablet, and then it's done. It might be sort of have that recovery, the re-flares, different things will cause problems down the track. So it's always something that can potentially circle back round, and it's not a quick fix. So there's no magic solution. Again, my apologies for going through the first part of this presentation very quickly. I'm very conscious of the time. DSM-5 criteria for PTSD. A lot of these things, as we see, the criteria that we look at to diagnose people with PTSD, you can't physically test it. You can't physically do the blood test. You can't physically see some of the different things. But the symptoms cause distress and they cause complications through all aspects of their life. I like this slide, and I'll come back to it a bit later when we talk about the endocannabinoid system. A lot of people with PTSD or mental health conditions will come in with small ailments. So they'll keep on coming back with little bits and pieces that they talk about, and unless you're really looking for those things, they'll come back with, high blood pressure, they'll have a racing heart, they'll have headaches, they'll have some of these symptomologies that you can see on the screen. And until you really start unpacking where they've come from and what's going on, you might miss the fact that there's an underlying mental health condition. So the whole body keeps score. Again, it's been spoken about in one of the last presentations, the crossover between PTSD and traumatic brain injury. There's more and more research and education coming out about these sorts of things, but it shows how complex these situations are. It's not a straightforward diagnosis, and often it's simply overlooked or misdiagnosed. But as we get more education and more people are looking into these injuries and illnesses, we're actually getting better at trying to diagnose and treat these things. One of the big things I look at when I'm treating a veteran and looking at treatment is the unholy trinity. So I talk about when they come in, they've all got a physical injury, they've got a mental health condition, and they usually don't sleep. So which one do you treat first, or how do you break the unholy trinity? It's something that is very important, and when we talk about the different treatments, these are the different things that I start approaching to try and work out how can we start the process of recovery. Again, we're 12 months on, so looking at the Royal Commission, and when we treat PTSD and things like that, I think some of the things that came to mind for me was Dr. Andrew Koo, one of the psychiatrists, who mentioned that he stopped counting the medications that are used for treating PTSD when he got to 70 tablets. So all the different tablets that were actually prescribed to treat PTSD, he got to 70 and he was still going. But it just goes to show that PTSD is not something that's simply treated by one medication. So many people are trying to do the best they can for their patient, but there's no magic solution for it. Again, we as Australian veterans are not dissimilar to other veterans around the world. So this is an article that shows some of the other medications, again showing how many medications and the cocktails they're often prescribed to veterans, and the fact that they talk about potentially some of the veteran suicides were probably veteran overdoses or accidental overdoses. Once you add these medications and you go through medical school and you get told, you know, this one shouldn't be prescribed with this one, but then when things aren't working, we add in this one, we add in the next one, we double the dose, we add in something else in the hope that we're going to try and achieve a better outcome. Then the veterans often like to add in alcohol as the other solution because they can easily obtain it. So by the time you start adding in all these different things, it becomes a dangerous cocktail. So we get polytrauma. So most veterans who've been injured, it's not just one limb or one system that's injured. So we get multiple systems. And then we add in polypharmacy. So over 5 medications, you've got polypharmacy. So when you look at some of the lists of medications, and anyone who treats veterans, the list of medications that they come in for their physical injury, their mental health injury, then you add in diabetes, their blood pressure and all those different things, you have a huge range. There's definitely over 5 medications, and I'm sure anyone in the room who's been treated for any of those conditions would probably guarantee that they've had more than 5 medications. So I'd like to do 2 things as we move forward. One, I'd like to talk about one veteran that I've treated with medicinal cannabis, and then some of the research. So I've treated a lot of different veterans with medicinal cannabis where that was deemed appropriate and where other things have failed. I've got a lot of anecdotal stories I can tell you about how it's helped this person or that person or the symptoms that they've treated. And so we've gone through some with University of Wollongong, and we've actually put together a retrospective analysis of deprescribing opiates, benzos and antidepressants from some of the clinical outcomes that I've got here. So this is just one person. Obviously, his name's not Bill. But as you can see, the list of medications, and these are just the medications for his physical pain and his mental health injuries. And if you add up the number of tablets, it's actually quite alarming how many tablets you'd actually consume in a year just for these conditions. So these veterans come in and they're not actually achieving what they deem as an appropriate health outcome. They would like a better quality of life, and they're searching for what they can do. So there's been lots of different treatment modalities and options discussed today, and I believe that each and every one of those ones has a place for the right person at the right time if they haven't achieved appropriate outcomes. So this gentleman here obviously had a range of different injuries and a range of different medications. And as you can see, multiple antidepressants, antipsychotics, the benzos and the opiates, they're all there. The physical, the neuropathic injuries and the mental health injuries. So my question is always, was Bill functional? And Bill was not functional. He didn't sleep. He didn't leave his house. He wasn't enjoying life. He was in what he deemed as chronic pain, and he was looking for a different solution, and that's why he came to discuss this as a different treatment modality. He had a range of specialists all trying to achieve a better outcome, but again, Bill did not believe he had a good quality of life at this point in time. So why was he looking at medicinal cannabis? The picture here obviously shows the endocannabinoid system and where it affects the body. So the good thing about it is it's widespread throughout the body. It's something that it's not just one aspect that we're going to be treating. We're going to be looking at receptors that are throughout the body and hopefully being able to provide some sort of treatment, a better sort of treatment outcome. But again, he was looking at it for the side effects of his other medications, the excessive weight gain, the addiction to the medications, the fact that he wasn't sleeping, all of those different things come together. And again, coming back to the slide about the mind-keeping score, they often present with a whole range of different injuries, and we're looking at medicinal cannabis and the endocannabinoid system is all throughout the body. So we're looking at something that may help with some of those symptoms. And again, it's not a magic solution when we give this to people, but it's something that may help different symptoms for different people to try and help them improve their quality of life, to be able to go ahead with other treatments, getting out to the gym, getting out in the garden, getting out and socialising, sleeping better, to be able to then improve their quality of life step by step. So how does a plant help? The endocannabinoid system is a messenger system throughout the body, and the plant has the phytocannabinoids. So those messengers help upregulate the endocannabinoid system when injury or mental health conditions have damaged that system within the body. So we're trying to use something that's very similar to the human endocannabinoid system to be able to help improve health outcomes. Within the plant, there's lots and lots of different things. So we talk about either using isolates and things, and I'll talk about isolates in the way of some of the side effects of treatment, as in the ability to drive and things like that, as opposed to the full spectrum parts of the plant. Remember, this is a natural plant that has lots and lots of, I would call, goodness in it. There's lots and lots of different things that they're treating, researching and sort of showing how it does actually give benefit to the body in certain ways. So they talk about the entourage effect and the improved anti-inflammatory aspects if we use more of the plant. So the better we can utilise all those the parts of the plant to improve the human endocannabinoid system, and that's the system within the human, we get a better effect. But again, there's certain things that we can and can't do with this plant, as we'll sort of talk through soon. So again, where do we start? Remember, this is an option that hopefully, and the TGA is trying to sort of push for, that this should be done at the local doctor. So we should be able to go into our doctor and have a conversation. Now, it is a strange way that it's prescribed, as in it's not a normal PBS script. It does have a special pathway that the TGA organises and administers, which means that not every doctor is going to be able to do this. But the hope is that it does become something that everyone is more comfortable about having that conversation with their doctor. So trying to talk to them, is it appropriate or not? If the doctor doesn't want to do it, how do we get that person to an appropriate prescriber who can do it in a safe and ethical way? It comes in a range of different products or different delivery systems. And again, the different delivery systems are going to be there for people under different circumstances. Again, they're slightly off kilter for what doctors would normally prescribe, as in a capsule or something like that where we know an exact dose and we can administer it at an exact time and we can put it in a Webster pack and things. But again, there's a lot of things about this plant that is being developed, and we're only moving forward. And this is part of it, is that there needs to have these conversations, and more people need to get involved and interested in it and the research behind it, so that we can actually gain more and more momentum, like any other modality that's been spoken about today. So again, it's not going to be for everyone. So there is going to be things like the ability to drive, which is a big topic of conversation when anyone talks about medicinal cannabis. There's a lot of hearsay and conjecture around it, but still there's a lot of unknown and a lot of research needs to happen in it. There's a lot of things around stigma. Remember that veterans have come from the military. In the military, there's a zero tolerance policy, unless you're probably from 2CAV, but that's a different story. They're things that the veterans will talk about. They'll come in and, I used to be the drug tester last week and now I'm discharged, now you're trying to offer me this as an option. It is something that's very different, and so it does need that conversation to change. But again, it's an option. Like everything else, they've been treated with the tablets, they've been treated with the different things, and now they're looking for, and veterans are a very smart and savvy group of people. We'll read, we'll look into, we'll research, and we'll come to the doctor and talk about what we've seen. So with some of the things that I've done with the University of Wollongong, again, I know this worked for different people. I could anecdotally talk to you about a lot of different things. So we actually put together a retrospective analysis of 156 patients. So there was a lot of patients that were taken out of the equation. They needed to be on the treatment for greater than a year. And these were different things. So a lot of it is their self-reported pain scores, so start and finish. And we know that you can have a good day and a bad day, but overall, through all 156, we saw that their pain scores dropped down. Looking up the top, we're looking at the deprescribing. Remember, it's a retrospective analysis of data. We didn't go through and say how many people had the next part of their neck fused, or how many people had a knee replacement during that time. So there was all sorts of different things that would change parts of our analysis. But really, the opiate deprescribing was really quite good. So yes, there are some people that increased their dose, but again, I think when we started looking back at it, it was things like, someone had another operation, and so by the time we got to them to a year, their doses had changed for various reasons like that. But in all, it shows some of the things that we were finding, that people were starting to gain benefits from the different treatments, getting them off benzos. Obviously, the government loves benzos and wants everyone off them. So utilising something that we can put in place that may be a better solution if used appropriately. Looking at other people's research, this is probably a big thing that I try and talk to veterans about, is the biphasic dose response. It's often less is more. So often people who come in wanting more and more cannabis, it's not actually working for them. They come in asking for more because they feel that, in typical veteran fashion, if one thing doesn't work, you should double it or have more. If you talk to them about alcohol, they don't drink one beer, they drink half a carton. It's this whole thing of, if I can do this, I can do it better by doing something more. I find cannabis is actually the opposite. There's a lot of research coming out about microdosing, lower doses, so not the high percentages that a lot of people are using and things, using the combination, so CBD and THC, so not just using the psychoactive components for pain relief, but using a better aspect of the whole plant, not just trying to isolate one aspect at a time. So you can see that too much is going to give them nausea. It actually increases their pain. And anyone who's worked in an emergency department, if they've seen people who've come in after a bit of a party weekend, cannabis will make you very, very, very sick if you've had way too much of it. Won't kill you, which is obviously a good thing when we talk about accidental overdoses with things like benzos or opiates. but you'll be vomiting for quite some time if you've done too much. So it is, I feel, a much safer option than some of these others, but again, it's got to be appropriately used, and it's not going to be a magic solution. Often it's in combination with a lot of things, and you still need those social aspects, which we'll go through soon. So Bill, I like to use this aspect of win the night to win the day. When a veteran comes in, you're not going to solve every problem in one consultation. If we start a new modality of treatment, you're not going to win everything in one fell swoop. You need to start somewhere. I find if we can break the unholy trinity by giving them sleep, we can often win the day. They can then go to the physios or start doing more activities during the day because they got a better night's sleep. Then we can step through. So once we've actually got a little bit of traction, we can actually start then adjusting the treatment. But again, we've got to use more of the plant. We can't just use THC, or we can't just use this or just use that. It's got to be in combination, because the whole plant has a lot of goodness which actually gives a better outcome than just using isolates and things like that. So CBD, the anti-inflammatory aspect of that is I find a real game changer, but you've got to convince people that that is something that is going to work, but it takes a little bit more time. So we target symptoms, and then as things go on, we then talk to Bill about learning to manage flare-ups. So we're not going to have a perfect back condition for the rest of our life. Once we're on a certain treatment, we're going to have good days and bad days. We're going to overdo it at the gym, we're going to lift our kid, or we're going to do something that'll give us a flare. We need to know what to do within the scope of our medications to help bring it back down. This is the other aspect that I'd like to point out, and it's sort of been pointed out in some of the other presentations as well. So this is actually the DVA wellness wheel. And as you look around the wellness wheel, you can actually see that, you know, there's so many different parts. The health is up there, but you've got education, you've got family, you've got employment, you've got finances, you've got all these other aspects that are going to help the veteran overall. You can't just fix up the health aspect and then they're going to be fixed. So I think this wellness wheel is quite good, and a lot of people have touched on similar aspects of having that holistic approach. We like to make sure that we're sort of trying to, when we deal with veterans, is trying to make sure that we can get them to their local doctor if their local doctor prescribes it, so their local pharmacy can dispense it and they can be involved in the local community. So it's trying to have those checks and balances in the local area. Unfortunately, this is still a developing medication, which means that it's not available. Not every doctor will actually prescribe it. So it's still in this infancy where we're trying to push that through to that. And again, the TGA and the bad press around this lately is really calling out the bad players in the industry and trying to make sure that we're trying to get a good aspect of this option for treating pain, mental health, sleep and things like that. So breaking that unholy trinity. So again, really focusing on that, the unholy trinity, we want to try and win the night, I would say, is win that one aspect. And it always starts by breaking that cycle, breaking one thing and then moving from there to actually start improving things. And again, we might not be able to deprescribe everything. As the research that I did, couldn't get everyone off everything, but we got people down a lot of the time, and therefore they had less brain fog, they felt like they could achieve more, they were taking less tablets, they felt like they could engage more. And again, this is one modality that I think really needs to be considered. If you want to contact us, there's different things. We've got the Facebook group, the Veteran Access Scheme, National Community Practice. This is where we're trying to collect up allied health and doctors, where we can provide and link in around Australia like-minded people and provide education, but also be able to sort of provide veterans with options of where to go for different things throughout Australia, because Australia is large. There's 600,000 veterans, they're all throughout Australia, and we need to try and support them all in some way, shape or form. Thank you very much.